Germany, like many other nations, has been hit hard by the coronavirus, reporting more than 120,000 cases since late January, according to the World Health Organization. But the number of deaths in Germany has remained lower than many other countries, whether in Europe or around the world. Joining us now to discuss is Germany's Minister of Health, Jens Spahn. Mr. Spahn, thanks so much for joining us. Good afternoon to you.
Good evening from Berlin. Hello.
Let's start on that topic that I just mentioned, if we could, whether we're looking at total cases relative to population, or in particular the number of deaths so far in Germany. It's a terrifying number in absolute terms, but relative to so many similar countries, you've clearly performed a lot better than some nations. Why do you think that is?
Well, Wilfried, in general, first of all, the fact that Germany is doing better so far makes one humble, not overconfident. And there are many reasons for it. I will just outline two or three. One is that we have a healthcare system that is in very good shape. And that is because of a success story, actually, of several governments. We invested in it too, but that is already a good base for many, many years. Secondly, we have a good network of general practitioners here in Germany. They take care of the soft cases to avoid an overrun of the hospitals. So the hospitals can take care of the severe cases. And then, traditionally, we have a high number of ICU capacities here in Germany. We have managed to increase it now in the crisis up to 40,000 ICU beds here, and that is a high number for a country like Germany. So we took it very serious from the very beginning, and that gave us time to prepare.
Oh, it seems as well that your testing capability has been far superior to that of perhaps the United States or the United Kingdom. Why is that? Were you already prepared for this in years past, or did you just manage to ramp up capability very quickly in the early months of this year?
Well, first of all, testing is crucial. It's like pointing a flashlight into the dark. If you don't do it, you just see different shades of gray. With extensive testing, you can really see what's going on. You don't just see the symptomatic cases, but the mild and asymptomatic ones too. And so far, we have tested 1.5 million Germans here, and we are trying to increase capacity day by day. What helped us is from the very beginning that we have a broad network of labs, laboratories all over Germany, traditionally as well. So actually that helped us from the start, and actually the first test in the world for coronavirus, for this one, actually was developed in Germany.
And so, Mr. Spahn, do you think that we're getting closer to a point when Germany will be able to reopen its economy? There's been sounds of good news on that front coming out of Germany in the last week, and then yet just today, about an hour or two ago, President Macron of France clearly pushed back the date for France. So where does Germany stand?
Well, so far we have managed through it very well, but now we need to find the right balance. It's not, I would say it's not the health of people versus the economy, because they are very much interlinked. You need a strong economy to have a well-equipped health system, for example, or unemployment recession is harmful for the mental and physical health of people too. So what we need to find is the right balance. And now with numbers down, the numbers of new infections per day in the past weeks, with all the measures that we have taken, we are thinking about step by step, that is important, step by step going back to a new normal. That is important too, because all the measures we have taken, like keeping distance, wearing masks, no parties, that are definitely measures that need to be there in place for months to come. And I'm very proud that our fellow Germans actually follow the rules, actually not because the government tells them to, but because there's a broad support for this. And that is, of course, very helpful, and that gives us confidence now, step by step, coming back to, as I said, new normal.
Mr. Minister, it's Sarah Eisen. It's good of you to join us. We're also wrestling here in the U.S. with the question of how and when to reopen the economy and get people back to work. I know you guys have done some experimentation with the antibody test, the serology test, especially in that hard-hit municipality of Gangelt. What have you learned? Are they accurate, and do they signal that people can actually go back to work? Are people being infected at a big enough scale to do that?
Well, so far there is no antibody test in place, at least as far as we know, that really is good enough to really take the decision if people are immune enough to go back to work, for example, in critical infrastructure like hospitals. But our people, our experts assume within 2, 3, 4 weeks we might have these tests, as they are already tested, as you mentioned, in the region of Heinsberg. And as soon as we would have them, that is, of course, a real game changer. If I might add something regarding production in Germany, for example, car manufacturing factories were not brought to a standstill by political decisions. That was a decision by the companies because many markets are inaccessible right now. And this is not a good time to sell cars to the world, obviously. And so actually many of the production lines in Germany are not working right now, not because of political decisions, but because of not having no access to their markets.
Germany's rates of mortality are so much lower than that of Italy, as Wilfred mentioned, even with a bigger population. I think it's 8 times fewer deaths, but also lower than that of the United States. What are you doing that we're not doing? I mean, we also have a very strong healthcare system in this country.
Well, actually, as I said, all we did and we tried to do is prepare as good as possible. And to actually take care of patients as soon as possible, especially with the general practitioners, taking care of the soft cases. Because what we see in some countries is that people only show up in the health system when they are already in a difficult, critical status, and then coming to the clinics. And what I find important is to try to reach out to them as soon as possible and to treat them as soon as possible to avoid as many severe cases as possible. And then, of course, our ICU capacities, the ventilation systems we have here in Germany. I'm very grateful and humble, actually, that we had this big base, this big number we could start from that really helped us in this crisis. For example, 3 weeks ago, we asked all hospitals to postpone elective operations. And by doing so, within 10 days, we had 10,000 empty beds in our ICUs. And most of them are, by the way, still empty and can be used for whatever comes.
Mr. Spahn, I wanted to ask about the long-term future of the European Union. I mean, free movement of people was such a central tenet of the EU, and clearly it's not happening at the moment. And at the same time, there's a lot of clashes on the shape of bailouts, on Eurobonds and the like. Do you think there's long-term damage been done to the unity of the EU?
Well, Wilfred, this is definitely a stressful time for the European Union. And as too often in a crisis, at the very beginning, the European Union seems to be very disorganized. But I would say now we have pulled the ends together and we are standing strong in this. We are helping each other. For example, Germany is taking patients from other countries here to Germany to treat them in our hospitals from Spain or France or Italy. And then there is, as you just mentioned, of course, the economic dimensions. With this 500 billion euro package that was negotiated by the European financial ministers in the past days, I would say we have a good base to help to support those who need economic support in this crisis. And at the same time, we don't set the wrong incentives for the future. That's a good balance between financial soundness and European solidarity that was found. And that shows, after some problems at the beginning, that were there definitely, Europe and the European Union is back on track.